Let's talk about the phase of your cycle and your treatment where you've just had your egg retrieval and now we are waiting to see what your embryo report is going to look like. In some ways, there's a big sense of relief. You've gotten through the egg retrieval, you feel okay, you're recovering, and now it's really out of your hands and you have to relinquish some of your control into what's going on in the lab. So this could be a really stressful part of your treatment cycle while you're waiting to see how your eggs and embryos do in the lab. On the day that we do the egg retrieval, you will know how many eggs were retrieved. The next day, on day 1, if you've done an egg freezing cycle, you will get a final report, which will tell you how many eggs are frozen and how many of those are mature. For an egg freezing patient, now your cycle is done and we'll do a follow-up and we'll talk about how to think about the number and what to do from there. If you are creating embryos, day 1 is the day that you're going to find out how many of your eggs were mature. Now, an average maturity rate is 70%. You're also going to find out how many of your eggs fertilized. An average fertilization rate is 70%. So you could actually go from 10 eggs to 7 mature to 5 fertilized, and that would be a normal average day 1 report. Then the embryos progress. On day 3, we usually take a look at them and give you a day 3 interim report. This starts to give us some information about your egg quality. People with good or normal egg quality will typically have a distribution of some embryos on this day that the lab judges as excellent and some that the lab judges as good. These are just subjective measurements of how the cells look under the microscope on this day. Then we progress to days 5 and 6 and even day 7. And this is the blastocyst day. This is when the embryos progress to where they have about 100 cells. They look like little soccer balls. And if you're doing genetic testing of your embryos, it is on this day that the embryos will be biopsied and tested and frozen. An average blastulation rate is 50% of the fertilized eggs. So in the example I gave before, you could go from your 5 fertilized eggs to 2 or 3 blastocysts, and that would be a normal report. Depending on your age, that impacts the percentage of blastocysts that are genetically, chromosomally normal or viable. If you're 35 and under, I would expect 50% of your blasts to be normal, statistically. So again, now in that same example that we just gave, you could be down to 1 or maybe 2 genetically normal embryos. If you're older, the statistics are lower than that. And so even out of 2 or 3 normal embryos, some women will have no normal embryos and some will be lucky and have 1 or 2 or even 3. So if you remember the way the statistics work, which is that over 50 or 100 patients, it's going to be 50% of them are normal. With each smaller sample size, your 2 or 3 embryos is a smaller sample size and the statistics are not always entirely predictable. So your 2 or 3 embryos could still be 0 or 1 or 2 normals, but it's going to average out over many patients to be 50%.